Welcome back to Ophthalmology for undergraduates and postgraduate beginners. Today's topic is examination of the conjunctiva. Before going to the examination of the conjunctiva, let us see what is normal about a conjunctiva. Then we will proceed to the examination and abnormalities in the conjunctiva. The conjunctiva is a translucent shiny mucous membrane. It has three parts. One is the palpebral conjunctiva, which covers the posterior surface of the lid. Bulbar conjunctiva, which is over the sclera of the eyeball. The junction of the two is called as the fornix. So these are the three main parts of the conjunctiva. Nowadays they have divided this conjunctiva into several sub parts. Let us not go into that because it will take so much of time. Today I am going to tell there are three important things in the conjunctiva. One is the goblet cells. The goblet cells are essential for secretion of mucus. It gives a protection to the surface of the cornea and the conjunctiva. Langerhans cells, they are the cells for immunity. These cells attack the agents that are invading the conjunctival sac or eyes. Melanocytes, they are there in the conjunctival surface, the epithelium. These melanocytes usually increase in number when the eyes are constantly exposed to dust, high heat. So these melanocytes will increase in number and this may give a muddy appearance to the conjunctiva. I have drawn a picture of an eye here. In this you can see in the bulbar conjunctiva that is close to the medial canthus, there is a small elevated portion which is called as the caruncle. It has some glands and hairs in it. Just lateral to the caruncle we can see a fold of conjunctiva that is called as plica semilunaris. The goblet cells are located around the cornea in the bulbar conjunctiva. So this is a normal anatomy we should know about. The bulbar conjunctiva looks white in color because of the underlying sclera. Now let me demonstrate how to examine the conjunctiva. To examine the bulbar conjunctiva fully, first thing you should do is gently hold the lower eyelid and pull it downwards and ask the person to look up. The patient looks up, you can see the lower bulbar conjunctiva fully. If you want to examine the upper bulbar conjunctiva, gently hold the upper eyelid and pull it upwards and ask the patient to look down. You can see the upper bulbar conjunctiva fully. If you want to examine the nasal bulbar conjunctiva, just pull both the lids like this and ask the patient to look temporally. You can see the nasal bulbar conjunctiva. If you want to see the temporal bulbar conjunctiva, ask the patient to look on the nasal side. You can see the temporal bulbar conjunctiva. This is how the bulbar conjunctiva is examined. While pulling the lower eyelid itself like this, you can see the lower palpebral conjunctiva as well as the fornix of the lower conjunctival sac. If you want to examine the upper palpebral conjunctiva, you can just avert the upper eyelid like this. So I have so much of practice in averting my upper eyelid, I am able to do it easily. If you want, you can practice with a cotton bud. Okay, that way you can examine the upper palpebral conjunctiva. In the upper palpebral conjunctiva, commonly what we see is foreign bodies. You can see papillae, you can see follicles, you can see membranes and pseudomembranes. It is time to see about the abnormalities of a conjunctiva. The first abnormality commonly seen is the redness of the conjunctiva. The redness of the conjunctiva may be more around the cornea. It may be heterogeneous. Heterogeneous means there will be dilated tortuous vessels. There will be increased number of vessels, but in between the vessels, you will have whitish sclera seen through. This type of congestion is called as circumcorneal congestion or ciliary congestion, which is classical of acute congestive glaucomas, corneal ulcers, then uveitis. Classically, it is iridocyclitis. The second type of redness, which is more away from the cornea. It is more in the palpebral conjunctiva, it is more in the fornisal conjunctiva. This is also heterogeneous type of congestion with dilated tortuous vessels. This is classical of infective type of conjunctivitis or allergic conjunctivitis. The third type of redness in the conjunctiva is homogeneous redness. Homogeneous redness which appears like a sheet-like thing. This is commonly due to hemorrhage below the conjunctiva, that is subconjunctival hemorrhage. The hemorrhage can be anywhere. The hemorrhage can be anywhere in the conjunctiva. So, the hemorrhage can be having any shape. It may be big or small. The subconjunctival hemorrhage may be initially bright red in color. But as time and days go by, this hemorrhage may become darker and slowly it gets faded away, and mostly by the end of third week this subconjunctival hemorrhage will disappear. The next most common abnormality in the conjunctiva we usually see is an allergic reaction. The conjunctiva will be edematous and it will be ballooning out. It will be ballooning out as if the cornea is in the deep. This is classical of allergic type of conjunctivitis due to edema of the conjunctiva, and this is called as chemosis of the conjunctiva. I have already told that conjunctiva is a translucent, shiny mucous membrane, but sometimes due to certain diseases, the conjunctiva may become dry, lustreless. The classical example is vitamin A deficiency, where you will have conjunctival xerosis, that is dryness. In vitamin A deficiency, I have drawn in black color, actually it will be in white color, and it will appear like a soapy foam or cheesy appearance due to collection of keratins and saprophytic bacillus on either side of the cornea. So this is what is called as Bitot spots. A Bitot spots is a very common exam case that is kept for your university exams, and you should be able to identify it. It will appear frothy or foamy, whitish in color on either side of the cornea in the interpalpebral fissure area. Next, we are going to see a spectrum of conjunctival diseases caused by the same etiology. That is constant exposure to ultraviolet rays and a dusty atmosphere, exposure to lot of dust. So this is going to cause a elastotic degeneration of the subconjunctival tissue, leading to metaplasia and formation of certain abnormalities in the conjunctiva of the eye. What are all the abnormalities that are seen? The first and foremost is called as the pingicula. Pingicula means fat. Here you can see a triangular patch which will be yellow in color. The triangle will have the base at the cornea and the apex will be towards the canthus. This is due to hyaline infiltration and elastotic degeneration. It is a degenerative condition. Next, I am going to talk about pterygium. Pterygium is a subconjunctival elastotic degeneration of the conjunctiva with a fibrovascular growth. Here, there are two types of pterygium. One is a pterygium which is active, that is called as progressive pterygium. The other one is pterygium which is inactive, that which is called as the regressive pterygium. Pterygium is also due to the same etiology I have told, and it is a wing-shaped growth of conjunctiva which may or may not encroach into the cornea. So if it is a progressive pterygium, it will look pinkish or reddish in color, which is highly vascularized, and it will have parts, that is, it will have a tail, it will have a body, it will have a neck which overlaps the limbus, it will have a head. In front of head, you can see whitish infiltration. Here I have drawn the infiltration in blue color. So this is called as the cap. So if you see such a finding, then it is classical of progressive pterygium. Pterygium involves the Bowman's membrane and stroma of the cornea, and epithelium will be growing over it. Next, coming to the regressive type of pterygium, because the pterygium has already stopped growing, the pterygium will appear whitish in color or brownish in color, and it will be wrinkled and small, as if as our age increases, the skin gets wrinkled due to aging. Similar to that, it has stopped growing, so it gets wrinkled and there will be no vessels on it at all. In front of the pterygium, you can see a red color line, which is deposit of iron in front of the pterygium that will be seen on the cornea. So that is called as Stocker's line. So if you see such findings, it is called as regressive pterygium. Sometimes from young age itself, in some patients, you can see a solid white mass consisting of skin, hairs and sebaceous glands, which will be very close to the limbus, which will be on the inferior aspect of the conjunctiva, and it will be on the temporal side. If you see such a mass, then it is a case of dermoid. One of the most common findings that we can see in the conjunctiva, that too in the palpebral conjunctiva, is papillae and follicles. What is papillae? It is hyperplasia of blood vessels surrounded by the lymphocytes and plasma cells. If you see in the palpebral conjunctiva, you can see small nodules which will have a central redness, and from the central redness, vessels will be branching over the surface. This is classical of allergic conjunctivitis. Papillae means the central vessels surrounded by cells. Follicles means collection of lymphocytes will appear yellow in color. Over this yellowish nodules, you can see blood vessels running. Follicular type of conjunctivitis is very common in trachoma, in viral conjunctivitis, in toxic type of conjunctivitis. Another important abnormality we can see in the conjunctiva, in conjunctivitis, is membrane formation. It will appear whitish or slightly greyish in color, which can be classically seen in the palpebral conjunctiva. The membranous conjunctivitis are of two types. One is true membrane, another is a pseudomembrane. A true membrane is caused by diphtheria infection. This true membrane will infiltrate into the conjunctival tissues, and if you try to remove them, it is very difficult to remove, and suppose you remove with some hardness, then it will lead to bleeding. A pseudomembrane conjunctivitis is caused by a viral conjunctivitis or pneumococcal conjunctivitis or gonococcal conjunctivitis. This pseudomembrane can be easily removed. Even if you remove it, it will not lead to hemorrhages because the pseudomembrane does not infiltrate. These membranes are nothing but exudates caused by conjunctivitis. Even though flectanular conjunctivitis is very, very rare, everyone should be able to identify if you come across a case. Flectanular conjunctivitis is nothing but an allergic reaction to endogenous proteins like tubercular protein, staphylococcus, streptococcus and parasites. A patient will present with lacrimation, that is watering from the eyes. Patient will have itching from the eyes. There will be a whitish nodule which will be close to the cornea, or it will be exactly at the limbus. Sometimes it may involve the cornea also. If it involves the cornea, there will be pain and photophobia. Conjunctival diseases classically presents with discharge from the eyes. A discharge from the eyes may be of several types. It may be a watery discharge. A watery discharge may be classical of a simple viral conjunctivitis. It may be a mucus or ropey discharge, classical of allergic conjunctivitis. Serous discharge, once again, it will be present in viral type of conjunctivitis. Blood discharge can be seen in gonococcal conjunctivitis. Mucopurulent discharge can be seen in chlamydia infections. Purulent discharge can be seen in bacterial infections of the conjunctiva. So, these are some of the types of discharges commonly we can encounter. I hope I have covered many things about the conjunctiva. It is not possible to cover everything about conjunctiva because it is a very huge topic. I have given some glimpses of what you will see commonly in the OPD while doing an examination in an ophthalmic case. Thank you. We will see once again in the next video.